Hello, everyone. I hope everybody is well. I hope everybody is staying warm. It's time for an update. I do have some information. I hopefully have some good, promising news, hopefully promising for down the road. I am going to talk about a website that you'll hear throughout this update. You need to get on this update. If you want the vaccination shot, you need to get on this website. It is Duchess Delivery. You go to duchessny.gov/Duchess Delivery. You get yourself signed up, your family members, whoever. Get yourself signed up. Get the information that it puts out, the updates that it puts out to all of you, and go from there. But duchessny.gov/Duchess Delivery is where you want to be. And I'll also give you the state number and the website again as well. But that's where you want to be. Okay. Right into the statistics for this week. Active cases are 1,541. Hospitalizations are 172, unfortunately. And again, unfortunately, fatalities are up to 347. But in our town of Dover, I have to say, we are doing much better. We are down to just 20 active cases. I don't want to jinx myself, but that is much better than it was a couple weeks ago when we were in them 50s and 60 numbers. Again, it's been a month or more since the holiday gatherings. We know why we went up. I don't have to mention the gatherings or the parties again. That's it. Last time. We know why we went up. And our county percentage on the rolling day 7-day average is 6.36. So the percentage is going down. Percentage goes down. The numbers go down. That is a good thing. Let's keep doing the right thing. Again, vaccine updates. Here we go. The vaccine update is this. Supply continues to be the challenge. We know the aggravation people are having. You got to have patience. I can't say anything different. It's not the town. It's not the county. It is the distribution. It is not adequate enough for the supply and the demand. And it starts at the top from the federal right down to the state governments, and then they allocate it to the counties. And then the counties put it out into their pods. It starts at the top. We're not getting what we were promised, and you'll hear those numbers throughout. Okay? This week, we received just a 600 dose allocation. 600 doses. That's all this county got. And we are only going to have one location open for the vaccinations this week, and that is the JCPenney at the Galleria. That is it. Unfortunately, the Dover site is closed this week due to the fact that we are just not getting enough. 600 doesn't go very far. So in order to streamline it, make it more easy for our workers and our volunteers to streamline things, make it more efficient, they're going in one location, which I totally understand. I feel terrible that the Dover isn't open, but that's where we're at. It is not closed forever. They are in negotiations with another site that will work out better for the situation here in Dover, where it can be open at any day during the week, at any time, weekdays or weekends. They can leave it set up. They don't have to tear it down every time they're done. Set it up and tear down is what was taking a lot of time at the school. We're fortunate we still have the school, but the supplies are just not letting us do it this week. And that is the problem. So we must be patient, okay? It will, I'm hoping it will get better. All the feds and states say it will, so let's see. Encourage residents to sign up and get the email, which I stated, the notifications, updates, including the appointment sign-ups through our Duchess Delivery email subscription service. That is the Duchess Delivery. Okay? The state hotline, the state has locations throughout the state of New York, the super pods, we'll call them. The number is 1-833-697-4829. That is open 7 days a week from 7 a.m. to 10 p.m. Or you can go to amieligible.covid19vaccine.health.newyork.gov. That is the state site. The closest ones to Dutchess County are the Westchester County Center and SUNY Albany. That's where they're at. They are a different type of site. You know, the county example is JCPenney in Dover, and the one up in the Rhinebeck area when it gets going, if it hasn't already. And the state sites are much bigger. easy to more accessible, and that is the county center in SUNY Albany. So that's where we are with that. Please note that the appointments cannot be made by calling Dutchess County's Coronavirus Information Call Center or the Department of Behavioral and Community Health, County Health Department. You cannot make the appointments by calling those numbers. Registered individuals who do have the vaccine appointment and show up should be prepared to show an ID. Example, driver's license, a pay stub, or a work ID to verify the eligibility for Phase 1A and 1B classification. Scheduling for second dose appointments will occur at the vaccination site as vaccine requires 2 doses for the effectiveness. We know that. All appointments should be considered tentative and are subject to cancellation if Dutchess County does not get the expected allocation of doses. Can't say nothing else. That's the way it is. Again, it's aggravating, but we have big numbers that are eligible, which I'll say in a little while, and that's the problem, supply and demand. Governor Cuomo last week noted it will take up to 7 months to vaccinate all who are now eligible in Phase 1A and 1B. 7 months at the pace we're going. Okay? Based on the current projected vaccine availability, eligible residents should anticipate it may be several weeks, months before they can get an appointment as demand far exceeds the supply. That's the governor. We've said the same thing. He's fighting with the feds. This is where we're at, people. I'm sorry. Local health departments and county governments receive allocation for and must prioritize essential workers in the 1B category. Hospitals will receive their allocations for and must prioritize their healthcare workers. That is important. That is a necessity, and that's the way that should be handled, and I agree with that. Pharmacies receive allocation for and are to prioritize individuals that are 65 years and older. I'll speak about pharmacies here in a minute. New York State mass vaccination sites receive allocation for and are to prioritize 65 years and older and essential workers in the 1B category. County receives information from the state about the allocations for the week and the current appointment availability as well. As vaccinations continue, all residents are reminded to continue with coronavirus safety measures, masks, frequent hand washing, social distancing. We've heard it all. We know, right? And this all does help. Obviously, the numbers are going down. Gatherings have gone backwards. Numbers have gone backwards. Again, residents can register to receive a notification when new vaccination appointments are open for scheduling at the county's COVID-19 vaccine information webpage, dutchessny.gov COVID vaccine. They fill up fast. We know. I've received the calls. What can you do? What can we do? Is there anything we can do? Supply and demand. I cannot say it enough. I'm sorry. There are 2 pharmacy agencies that are doing this from what we are being told, and that is Rite Aid pharmacies and Tops locations. I believe that's the Tops markets. The Rite Aid locations that will be used here in the area, Rite Aid, 40 Vassar Road, Rite Aid, 320 Main Street, Beacon. Vassar Road is in Poughkeepsie, sorry. Rite Aid, 129 South Avenue in Poughkeepsie. Rite Aid at 1 Crum Elbow Road, Hyde Park. Rite Aid at 3350 North Road, Poughkeepsie. And actually McCarthy's Pharmacy at 6032 Route 82, Stanfordville. Go online. Make sure that is correct. It doesn't always mean because I'm reading it, it's going to be final. That's the locations that we're being told. Go to them. Each of these sites received only 100. They will receive only 100 doses a week. These locations are exclusively for 65 and older residents. As with other locations around the state, these sites have very limited supply with extremely high demand. Okay? Again, supply and demand. We can't say enough. They're not getting us enough. They are not getting us enough. Okay? That's just the way it is. I'm sorry. Again, can only read to you what is updated to me. The the county asks residents, this is the county executive's update, by the way, I'm sorry. We continue to ask residents for their continued patience during the state-operated COVID-19 vaccination process. Here are some numbers for you. There are more than 7 million residents currently eligible for vaccination under the New York State Phased Distribution Plan. Currently, the state is receiving approximately only 250,000 to 300,000 doses per week. And while reports indicate that number is expected to increase slightly from the feds, the demand for vaccines will still far exceed the allocated supply. Supply and demand. Here we go. This week, Dutchess County government will open a point of dispensing located in the former J.C. Penney to vaccinate eligible Dutchess County residents. We talked about that. The county will only operate one pod this week. We talked about that. J.C. Penney only in Dover. Pod operates by appointment only. This week, 600 appointments based on the 600 doses. The county is once again booked within moments of the county's announcement of the new appointment availability. County Executive Molinaro advised residents to sign up now to receive emails or text messages notifying them of when appointments for vaccination will be available at the pods. Visit dutchessny.gov/COVID vaccine to sign up for the alerts, as well as for the latest vaccine information and updates about new appointment availability at the county-run pods, J.C. Penney, Dover, Rhinebeck. When additional vaccine doses become available from New York State, again, please do not call the county health department. Call the New York State's COVID vaccination line. I gave you the numbers of 1-833-697-4829 or the website. Again, Dover location is closed this week. So for those of you that may have hoped to go there, I apologize. The following discussions between regional executives and area public health officials, the 7 counties of the Hudson Valley region will authorize the high-risk sports, both scholastic and non-scholastic, to proceed effective February 1st. This was a big deal. This is a big deal. These kids need it. These kids are looking at 2 years of very limited sports, if any, 2 years of no proms, 2 years of no senior balls, banquets, 2 years of possibly no graduation. This was a big thing last year, and it's still on the table for this year. And these kids are losing valuable life experiences, memories. They're not getting them. These kids need things to break free. This is a good thing. These activities include, but not limited to, football, wrestling, ice hockey, rugby, basketball, contact lacrosse, volleyball, martial arts, competitive cheer, and dance. In accordance with the state guidance, county health departments in the region will also monitor whether there has been a more transmissible variant of COVID-19 identified in the area, as well as the percent of local residents who test positive. This was big. This was 7 counties. Dutchess, Orange, Putnam, Rockland, Sullivan, Ulster, Westchester County. They got together, they put their heads together, and they got it done. Again, it is based upon schools deciding to go with it. County executives from the 7 counties have issued the following joint statement. Interim guidance for sports and recreation during the COVID-19 public health emergency, dated January 22nd, 2021, published by New York State. Following discussion was with the New York State Association of County Health Officials, regional county executives, and area public health officials. The Hudson Valley region will authorize higher risk sports, both scholastic and non-scholastic, to proceed effective February 1, 2021, at the sole discretion of the governing school district or non-scholastic athletic organization. I read what they would include. In accordance with the state guidance, county health departments in the region will also monitor whether or not they have been more transmissible variant or COVID-19 identified in the area. I mentioned that. You can go to duchessny.gov to see the full report. Be smart and be safe, and keep the kids interested. That is the problem. We need to get these kids back, but it needs to be safe, and we all need to keep that in mind. We need to do what we need to do to keep it safe, but these kids have missed a lot. Let's keep the numbers going backwards so we can get down and do some things, okay? I wanted to just say, remember to stay smart and be safe as always. And as you can see, our numbers are going backwards. We're doing the right thing. The holidays are over. The gatherings are over. They're going backwards. Let's keep the numbers going down. And if we be smart and be safe. Again, life imposes things on you that you can't control. But you still have the choice of how you're going to live through this. Live through it the right way. We get the numbers going backwards. We get down. We slow that curve that we had going up again through the holidays. Let's get it back down. I do want to say that this weekend, this weather does call for very cold temperatures. Please be careful. Wind chills of -2 or more in the next couple days. We are watching a storm coming in Monday, Tuesday time frame. The county highway, as myself, have been monitoring it. We are watching it going into Monday, and I will keep all of you abreast of what's coming at us, and as well as our highway superintendent, Jason Sartori. So always remember, everybody, we are Dover, and we are strong, and we are Dover strong. We are one team, one town, and we are the town of Dover. Be safe, be well, and as always, please stay healthy. And until next time, God bless. #Dover Strong. Have a good weekend, everybody.